Good morning, I'm Dr Kerry Chant from New South Wales Health with the COVID update for Monday the 18th of October. There were 265 locally acquired cases of COVID reported in New South Wales in the 24 hours to 8 p.m. last night, and more than 60,000 COVID tests were reported during that period. It is essential that we continue to come forward and get tested. High testing rates will ensure we find COVID and prevent its further spread in the community. Across New South Wales, 92% of people aged 16 and over had received a first dose of COVID-19 vaccine, and 80.3% were fully vaccinated. We thank everyone who has come forward to protect themselves, their loved ones and the wider community from COVID. In the 12 to 15-year-old age group, we've got 74.5% have had their first dose, and around 34% are fully vaccinated. That's an amazing achievement in such a short period of time. There are currently 606 COVID cases admitted to hospital, with 132 people in intensive care and 71 of whom require ventilation. And again, a high proportion of those in intensive care are those that are not vaccinated. So 103 of the 132 of the people in ICU intensive care have not been vaccinated. Sadly, New South Wales Health is reporting the deaths of 5 people with COVID, 4 women and 1 man. And can I extend my deepest condolences to the families who have lost loved ones. A woman in her 30s from Cessnock area died at John Hunter, and she was not vaccinated and had underlying health conditions. A man in his 50s from Sydney's Inner West died at Concord Hospital, and he was not vaccinated and had underlying health conditions. A woman in her 60s from Sydney's Inner West died at Royal Prince Alfred Hospital. She was not vaccinated. A woman in her 70s from southwestern Sydney died at Concord Hospital. She had received 1 dose of COVID vaccine and had underlying health conditions. And a woman in her 80s from Wollongong area died at Wollongong Hospital, and she had received 1 dose of the COVID vaccine and also had underlying health conditions. In terms of the suburbs of concern, I want to call out particularly Wallsend, Hassel Grove, Auburn, Charlestown, Blacktown and Yagoona. Please come forward if you have the most minimal of symptoms, get tested. That will again help us protect you, your loved ones and the broader community. We're pleasingly seeing some return to school today for our kindergarten year 1 and our year 12 students. Again, a reminder that COVID can be quite a mild condition in young children. Please keep them home if they have any symptoms and get them tested, and also support your children to explain why we need to have those COVID safe practices in the school to ensure that we keep schools as safe as possible. In terms of vaccination, it's so pleasing to see every day more and more people are protected with both 1 dose and 2 doses. But there's also been recent recommendations that some individuals in the community need a 3rd dose as part of their primary course of vaccination. So the Australian Technical Advisory Group on Immunisation, which provides us that wise advice, indicated that for those people whose immune system is not working as well, they actually need 3 doses as part of their primary course. So if you are on renal dialysis, if you're undergoing cancer treatments, if you're taking medication to suppress your immune response, you may need that 3rd dose. Please call your doctor or visit your local pharmacy and see if you need a 3rd dose. And if you do, get that dose as soon as possible. That will increase your chances of being protected from COVID. Also, it's so pleasing to see that uptake in the 12 to 15-year-olds. Again, we can aim higher. So whilst I'm very pleased to see around 74 to 75% have had their first dose, I want to see that get up around 95%. So again, with schools going back, please help and get those 12 to 15-year-olds vaccinated. Again, thank you very much to the community for all your efforts. As we move to this transition phase of living with COVID, we still need to be mindful of the threat it poses and continue to do those simple things. wear masks when required, not to go out and about when we've got those symptoms of COVID. Please get a test instead and remain at home. And also just keep that physical distancing and those other measures. If you are particularly have chronic illnesses or other factors, you might want to talk to your doctor about your particular risks, but it may be that you want to choose to visit with friends and families in more outdoor environments and take some additional safety measures as, again, we transition to live with COVID. Again, thank you to the community for their amazing efforts to date. There's more work to be done. Let's get to the highest vaccination coverage we possibly can and leave no one behind.